So when we give the treatment to the patient, always we have to keep the documentation, right? So a good documentation protect your patient, protect you, protect your license. So if something is happened by other or by the client, so your documentation with your signature can help you. So a good documentation also help to easily understand the person who is going to join your place after your shift will be over. So like you are working at the morning day shift, at the night shift, other aren't going to replace you. They can read your documentation and they quickly understand who is the most priority patient, what the information is need to take care, right? So when we write the documentation, or we have to know, or when we take the history from the patient will tell you some complaint, right? So we said it's a chief complaint. So patient will say, I have a fever. You can touch or measure the fever. If patients say, I have a pain, you do not feel the pain. You do not measure it by any procedure, right? So some of the sign and symptom, the sign and symptom of the disease, we say the data, health data. So the data are categorized subjective data and objective data. So objective data means what you observe, what is observable, right? And also we can measure or measurable, like vital sign, right? So objective data, basically what you see, what you hear, what you feel, what you smell, right? So when patients say, I have a fever, you measurement the fever. If patients say, I have a high blood pressure, you can measure the blood pressure systole and diastole. It is measurable, right? Or I said, if patient, uh, what explain? So see or hearing or feels or smell. But when you take the subjective or objective data, do not include your personal opinion or any kind of interpretation of data. When you write, you have to mention what patient explained to you, right? So you are not allowed your personal opinion or interpretation of data. Some of the data is called subjective data. Subjective data means symptoms experienced by the patient or by the client. If patients say, I have a sore throat, how you have to measure it, how you have to examine it. But is the patient complaint, right? So I said the subjective data, basically we have to document as direct patient quit or clearly identify the information as a statement by the patient. If patients say, I have a sore throat, or if patients say, I feel my stomach is full. So you wrote, according to the patient's statement, he complained of sore throat. He complained of fullness of the stomach. It is the subjective data, right? When we write down the subjective or objective data, we have to follow some legal guidelines, right? And basically, we have a national guidelines, also institute policies we have to follow. So during the data collection, what are the legal guidelines we have to follow? So when we write the data, we will not give our own personal opinion. And also I said we will not interpretation of data. We do not leave the blank space in between two lines in documentation, because we do not know everybody are friend in the station, but who knows, you have a maybe anyone the silent enemy in between the two line. If you keep or left the space, anybody can write something and it make you the trouble, right? So do not leave the blank space, and also do not use any correction, or do not use any correction tape or fluid or scratch out or black out word. Include, and if you do something wrong, if you need to correct, you have to just draw a line all over this, and also you have to write your name and title and signature if you need to correct something, right? So do not use the correct fluid or erase or scratch out. Sign all of the document as the facility require. Also, documentation should reflect the assessment of the patient, intervention, evaluate, or patient progress, right? So a good documentation, when we analyze this, we can improve the quality of the service. So documentation should reflect the assessment, intervention, evaluation, and not personal opinion should be included, or any criticism about the client or other healthcare provider. Nothing we have to document. And now it is called incidence report. Incidence. So when you work, right, sometimes something unusual things can be happened. So incidence report, we have to, like your patient suddenly fall, right? Or you do something wrong with the patient, or if you give some wrong medication, all are incidence report. So it is called unusual occurrence. So incidents report are an important part of facility quality improvements plan. So if we do something wrong, we have to write it down in different incidents report form. Incidents report is not the part of patient documentation or patient prescription or medical record, right? Incidents report created when any accident or unusual event occur. Example, medication error or patient fall. So if your patient is fall, what you should do, you have to go and help your patient and help them to get back their position. So if patient is sitting on the chair and they suddenly fall, you help them to reposition. In the same time, you have to check the vital sign. You have to check any kind of injuries. If you feel there are no injuries, vital sign is okay, you have to come for incidence report. But after finish the incidence report, you have to go again and again check the vital sign and also thoroughly exam or check up. Why? Because some of the complication or some of the injuries is reflex, take time, or few minutes later you can see, right? So I said, when we write the incidence report this incidence report used for quality improvement at the facilities. So if we do something wrong, we can learn for the future. So if I say in elderly unit, the most accident is the falling patient. So we have to prevent the fall, and by this we can prevent the injuries, right? So when we do the practice like this, and we can prevent the fall in elderly unit, so this is quality improvement, and sometimes we say evidence-based practice. So it is on incidence report, it is not as I mentioned, it is not the part of the patient record and should not be referred to the patient medical record, right? So this is important about the documentation and incidence report.